There are some post-procedure complications that you should watch out for after your AFib ablation. Most of the most serious complications after AFib ablations are very rare. However, you should be aware of the symptoms of these so that the office can be alerted. Watch the risk of ablation video with Dr. Osorio for more details about the specific complications of AFib ablations. So first off, you should monitor your temperature after the ablation and alert the office if you have a fever of greater than 99.4 degrees Fahrenheit. Monitoring your temperature is important because it can alert to a potential sign of infection or, in very, very rare cases, the presence of an atrial esophageal fistula. You should also alert the office if you have new onset difficulty swallowing, or if you feel like food is getting caught in your throat, or if you have new or worsening indigestion or heartburn. Again, both of these symptoms can be a sign of a very rare but serious complication of an AFib ablation called an atrial esophageal fistula formation. Patients typically won't show signs of the fistula formation for a few weeks after the ablation, so that's why it's really important that you be monitoring these symptoms, not just for the first week, but as time progresses as well. A medication called pantoprazole, or Protonix is the brand name, is called in after the ablation that you should take for 30 days post-procedure to help potentially reduce the risk of esophageal irritation if you're not already on a similar medicine for your stomach. They'll call that pantoprazole in. You should let the office know if you're experiencing shortness of breath after the procedure. If the shortness of breath is severe, you need to proceed to the emergency room. Shortness of breath can indicate many different issues, including fluid around your heart or lungs, which can be serious. While some mild chest soreness is common for the first 1 to 2 days after the ablation, if it persists longer than this period, and especially if you still have any pain while you breathe in, please let the office know or be evaluated, as this can be a sign of pericarditis, which is inflammation around that heart sac. Another thing that you should be aware of are signs of potential groin site complications, such as bleeds, pseudoaneurysm formation, AV fistula formation, or hematomas, which is why you should monitor your groin site incision carefully post-procedure. If your groin incision site opens up and starts bleeding or oozing after you are discharged home, you should hold pressure on the site and firmly apply a pressure bandage while continuing to hold pressure until the bleeding stops. If the bleeding persists longer than 15 minutes after holding pressure, you need to go to the emergency room. If the bleeding is shooting out blood, apply the pressure bandage, hold pressure firmly, and call 911 immediately. But if it's just kind of like oozing slowly, try to put that pressure bandage on first, hold that pressure for 15 minutes and see if it goes away on its own. And if it doesn't, then go to the emergency room, okay? It's not uncommon to have a small knot post-procedure, but if your groin site is swollen or red, please let the office know. You should circle the initial groin knot border with a marker, and if it grows beyond your little marker border, please let the office know. It's also not uncommon at all for the groin site to be a little tender to the touch for the first few days after the procedure, but if you experience a sharp or a shooting pain or a severe pain in that groin site when you press on it or when you're walking, you need to let the office know, as it can be a sign of some of the groin site complications we discussed.